Hi, I'm Douglas Joyce, the founder and owner of the Joyce Vein and Aesthetic Institute. We are a state-of-the-art venous treatment center located in Punta Gorda, Florida. JVAI is very different from your common vein clinic. These type of institutions often deal with cosmetic venous disease, spider veins, varicose veins. The problem is that there's a high reoccurrence rate with this because the underlying venous disease is never treated. And that's our emphasis at JVAI. We start with a patient with a full medical evaluation, then a full ultrasound evaluation, and our purpose is to identify what the problem in the venous system is that is causing the reason that they came in. If they've come in with pain or spider veins or varicose veins, there is a reason in the venous system for that. We identify that, and then we use our state-of-the-art techniques to use laser surgery to correct that problem. We're then able to do the cosmetic work, but the difference is now it doesn't come back as readily, and also the symptoms that bring these patients in, such as pain, swelling, trouble sleeping at night, resolve. We see all types of patients with venous disease. The simplest venous disease is a patient that comes in with spider veins, which are just superficial venous markings on the leg. And then this progresses to the patient that comes in with visible varicose veins. The next stage would be a patient that comes in with discoloration of the leg, usually of the inside of the ankle. And then the next stage would be thickening of the skin. And then finally, there are the most unfortunate patients that have severe venous disease, and these patients actually have ulcerations or breaks in the skin, usually on the inner ankle. And our focus is on all of these types of venous disease, and our approach is the same for all of them, to determine the underlying problem and then to correct the underlying problem. The treatment of venous disease has a major impact on every patient who has it done. Patients that come in simply with cosmetic spider veins and have just spider vein ablation are more able to wear shorts or dresses or feel more comfortable exposing their legs in public areas. And this is a major thing for people who've been hiding their legs for years because they're embarrassed by spider veins. Same is true of varicose veins. When you start to get into more serious venous disease, you have the other end of the spectrum. You have people with ulcers that have been on their legs for 10 or 15 years. They can't wear clothing. They can't go out. They have to carry pads with them. They have to wrap their legs. Their life is a misery. The ulcer burns. It weeps. And when you perform a venous surgery set of procedures on them and the ulcer heals in 3 or 4 weeks, I mean, they come in and they're crying. They can't believe that their life has changed like this, that they now are functional and they don't have this on their leg anymore when they've been told by physician after physician after physician, there's nothing you can do about it. I had a young woman come in several weeks ago, actually, who was 22 years old and came in because she had some spider veins on her legs. And I started talking to her, and I always ask the same questions. Do you notice a swelling of your legs? And she really didn't. I said, well, do you have any pain in your legs? And she goes, well, at the end of the day, my legs really ache. Then I said, well, how about when you sleep at night? And she said, yeah, I have a lot of problems sleeping. My legs are restless, kind of like that restless leg thing you see on TV. So I told her, I said, my recommendation would be to get an ultrasound of your leg and see what's going on. And she had had a child about 6-7 months previously. So we did an ultrasound of her leg. And she had horrendous venous disease. Every system of veins in her leg was massively dilated. She had veins in her leg. Her saphenous vein was the size of literally my index finger, which is, for a woman, probably 3 times too big. And on questioning, it turns out that during her pregnancy, she had tremendous veins all over her legs, which had gone away after she had delivered, and she had exercised a lot and gotten herself back in shape, and she had thought they were just going to go away. But the problem was that she had damaged some of the main valves in the veins that lead into the deep system, and it was progressing, and she was just starting to get all the spider veins, and she was headed literally for a life of major venous disease. And so we recommended doing the laser surgery on her, which we did, and she had an excellent result. And now she'll be saved from all that disfigurement, because eventually she would have come in anyway because she would have developed the venous disease. I had a patient who was a 42-year-old man who had suffered with a horrendous ulcer on his leg, and he had had this ulcer for 10 years. It started when he was like 32 years old, and it had pretty much destroyed his life. He had a child. He couldn't play football with the child. He couldn't do anything. He couldn't swim. He really didn't go out in public much. It was a total embarrassment. It leaked all the time, and it was horrible looking. And he had suffered with this. He'd seen multiple doctors. He had gone for multiple skin grafts. He had had arterial evaluations, and he was pretty much told nothing could be done. And his mother saw an ad that we had in one of the local papers, which was a picture of a gentleman with an ulcer that we had worked on, and it had healed. And she called him. He lived in Alabama. And she called him up and told him that she had seen a leg in this article that looked just like his. And he ended up driving here, and we waited after hours for him and saw him. And when we took the bandage off of his leg, it was unbelievable. I mean, it was actually shocking how horrible this leg looked like an animal had gotten a hold of it or something. And we evaluated him. He had severe venous insufficiency. We were able to work on his leg over the next couple of weeks and close all of the veins that were causing a problem with lasers. And within a period of 2 months, the ulcer had healed completely. He absolutely could not believe it. And it changed his entire life. I mean, he called me up. He was playing football in the backyard with his kids for the first time. He was swimming in a pool with them. He was doing things that he could never do before. To make an appointment, you're welcome to call our toll-free number, which is 866-998-1312, or visit the venous section of our website, www.jvai.com.